Thank you. Good afternoon. Actually, today is a big day because in one roof we are all here. There is the, you can see the snake lovers, snake rescuers, the physician, you can see the nodal officer, the researcher, Dr. Ravi Dole, and Dr. H.T. So everybody is in one roof, and I request all of you to give a big round of applause for Jayaditya Purkastel and this is in the northeast. This is for the first time these things is happening. That is in the under one roof we are all meeting. So my topic will be the challenges and the under-reporting, and I declare that I have taken consent from the patient, the parents, and at the same time I declare this for the photo I am showing here. There is a credit goes to Dr. Farooq Ali and Prasanna Kalita for good photography. And challenges, what we are, you know that few numbers of the patient, you can see the many number of the patient after snake bite, they do not attend hospital. And if they attend to hospital, the doctors are scared to give the antivenom or record medication, and they give one sleep, that is the refer. So refer to the higher center, and most of the time on the way the refer to the higher center, they dies, isn't it? And at the same time, we have that is logistic supply, the issues are there, but in 2024, the leadership of Dr. Loskar, State Nodal Officer, every community health center in Assam is getting the antivenom. And at the same time, other logistic. And there is a government order also. If any community health center is not getting this antivenom, you please raise queries and ask your superintendent to supply this medication at the CSC and model hospital. So we have created a model that is in our Demow community health center, that we have to bring these victims to the hospital, because after snake bite the people goes into the painkillers. If they do not come to the hospital, our efforts will be zero. So we have to bring this patient to the hospital, and this cannot be done sitting in an AC room. We have to go into the field. So the first thing is that we have to make a community awareness. So that is the key. It means we have to bring the patient to the hospital. Now from the community awareness, we have created a person that is called a venom response team. So he is an educated person. So he will the mukhia of the communities, and he will inform us about the snake bite in the communities. Okay. So we are talking about the app and all, but 95% of the patient do not have any smartphone. Error ki thake ekta feature phone thake, smartphone na thake. Aru teluke apnar dhorok mobile to apnar recharge koribo norare. So tenuka dhoroner victim amar osor ase. So we have to think about the field level. So we have created a person that is called a venom response team from the community, and we have formed a WhatsApp group that is with the venom response team. It was a small group at that time when we have started in 2018. That is around 20 or 15 numbers of the patient, that is group members. Now it is increasing day by day, and many of the members are many of the present here are the members of this group. Then we have created one room. They converted the room into a snake bite treatment room, which is adjacent to our casualty, where we have displayed all the venomous snakes of our Assam, as well as we have this all required medications. That is openly, means we are not putting this or medication in lock and key, so that everybody, whenever needed, they can infuse the antivenom or required medication. And we have trained our staff. These are called trained staff. This is called a fast response team. So whenever yesterday I came here, today only I came to Guwahati, and our fast response team, that the sister told me, sir, there is a pain and the swelling, and there is no systemic sinus symptom, probably it is a pain fiber. You do not worry, you go to the Guwahati. So this response is coming from our sister. So we have to train not only our doctors but also the sister, because these are the people who are very much contact with the patient. Whenever we put the patient in the observation in the hospital, so these groups are the main groups. So we have to train our staff. So these for the fast response team, so that they can identify this is danger sign. These are the danger sign. These are the danger sign of cobra. These are the danger sign of crate. These are the danger sign of pig virus. So they can identify and they can inform the doctors, or that is only the doctors. So you can see the result in 2018. So snake bite to the hospital admission time was 6 hours, Now it is slowly reduced, and it is in the 2022, it is 25 minutes, 20 minutes, or it is less than 1 hour. So snake bite means bypassing the fair dealers and they are coming to the hospitals. So this is the impact of our model in snake bite management. So you can see the data in 2018, there are only 20 numbers of the patient, and but this is 19, 20, 21, 22, 23, 24, and this is 25. So this year we have around 481 number of the patients. So patient turnover increase. So that whenever the patient comes to our center, so we can study the symptoms as well as the venom dynamics, isn't it? So from 2018 to 2025, we have around 3152 patients. Of this, the venomous numbers is only 14.27, and date is only one, that is in year 2020. And we are also getting data from the Assam portal, that is around 11,000 of snake bite happened in the last year, that is in the 2024. So we have our collaboration. Then as we have achieved zero death, almost around 4 years, that is 21, 22, 23, 24. We have zero death in our hospital. Then we thought of expanding this concept to whole over Assam, and thanks to our nodal officer, Dr. Loskar, and as well as our researcher, Robi Dole sir, and everybody, you people, the snake rescuers, all people that help us, and so that we can expand these things into the all over Assam. Then we tried to form a venom army. Venom army is nothing, anybody can be a venom army. Any public, any doctors, any nurse, everybody. So who are interested in this subject can be a venom army. So they can phone us, they can call us, sir, there is a snake bite patient is going. Yesterday only in the Kio, patient was bitten by a snake, and then the victim went to the Jorafuka, this is the fatal, and he called me, sir, Jorafuka like we say, patient to Kio, right? So this is a venom army. So he said, you can say every Assamese as of now in 2025 are a venom army, and thanks to all of our public. Now these are the challenges. So once we got the patient is coming to a hospital, and the things becoming that we are giving the treatment, we have given 10 plus 10 vial, and patient died on third day. Why? Doctor asking me, his brother is always complaining me, sir, আমি তো হুঙ্গালে গৈছিলো মোৰ patient মোৰ ককাই কেলে মৰিলে. This is hospital A. Hospital B, again patient has night bite, and patient has again 10 plus 10 antivenom. Patient died. আকৌ সুধিছে, ডক্টৰে সুধিছে যে স্যার আমি তো ট্রিটমেন্ট দিছিলো, patient কেলে মৰিলে. So what is the solution? Hospital C, so the patient having the pain and swelling and coagulopathy, blood is not clotting. So the hospital C is giving almost around 55 vials of the antivenom. Still patient blood is not clotted. What is happening? So these are the challenges. And hospital D, Naga-Kauthia bite, and patient is already having antivenom, and every medication was given to the patient. Patient was okay, but at 70 hours again patient become unconscious, and doctor called me, what is happening? It is nothing but this is called the recurrent neurotoxicity. Sometimes after 70 hours the Naga-Kauthia bite causes recurrent neurotoxicity. These things are not our doctors and the nurses are not aware of these things, recurrent neurotoxicity. So this happens only in Assam or Northeast, because Naga-Kauthia causes recurrent neurotoxicities. So this is what we are mistaking, that we do not have any big four. These are called the big four: Bungaras ceruleus, Bungaras vapori, Iscarinatus, and Naza. And interestingly, Assam do not have this big four, because Assam is having the troublesome 6. And what are troublesome 6? These are all troublesome 6. That is the Trimeroceras. No need of antivenom here. Antivenom will not work. Naga-Kauthia, again we are increasing the dose of antivenom to 20 vials, because we do not have any specific antivenom. Bungaras fasciatus, again we are giving large numbers of the antivenom. Bungaras niger and lepidus, again large numbers of antivenom we are giving. And Rhabdophis hilaris, no antivenom. And Ophiophagus hana, with no antivenom. So no antivenom, and no antivenom. We are giving only here, and only in this snake bite. So this is the problem, and do not worry about the Russell viper, because we have around 8 numbers of the confirmed reported Russell viper bite in Assam, and here only 2 numbers of the death is reported, that is in the Tezpur Biguri area and in the Bongaigaon area. So do not worry about the Russell viper. Our government institutes is treating, our government rural hospital CSC, that is in the Dhubri, Nakipur, Zaman, and team is treating these victims successfully. So do not worry about that. Only thing that কেতিয়াবা যদি হিৱাগৰত বা আপাৰ আসামৰ ৰাসেল ভাইপাৰ ওলাই তেতিয়া আমাক ইনফৰ্ম কৰি দিব আপোনালোকে। সো আপোনালোকৰ পৰা আমি ইনফৰ্মেশ্যন পাম। নলবাৰীত যদি আপোনাৰ ৰাসেল ভাইপাৰ ওলাই, কাইলৈ যদি আপোনাৰ ধৰক নগাঁৱত যদি ওলাই, সো ইউ আৰ দ্য পাৰ্সনস ইউ ইনফৰ্ম আস দ্যাট ৰাসেল ভাইপাৰ ওলাইছে। এতিয়ালৈকে আমি কেইটা জনত ৰাসেল ভাইপাৰ নাই বুলি আমি কাম কৰিছো। অনলি this is Bongaigaon, Chirang and Kokrajhar and Tezpur Biguri area Russell Viper to দেখা পোৱা গৈছে। So interestingly, challenges is there because we have Trimerocerus and antivenom are against the Naza, and we do not have any Naza. Antivenoms are against Bungarus ceruleus. We do not have any Bungarus ceruleus. We do not have any Russell Viper. We do not have any Ichthys kinetus. So how we are getting result? আমি result কেনেকৈ পাইছো? তো ন্যাশনাল গাইডলাইন যেটো ফলো কৰি আছিলো আমি 10+10 হেতু ৰলনে আমি কি একেলগে বেসিকে দিও, দ্যাট ইজ 25। সো আজি যদি আমাৰ স্পেসিফিক এন্টিভেনম হলেকান আমি 20 ৰলনে 5টা বা 6টাতে কাম হৈ গলকান। যেহেতু নাই আমি এতিয়া তেতিয়ালৈকে আমি কি কৰিব লাগিব, অলপ লাৰ্জ ডোজত আমি কাম কৰিব লগা পৰিছে। So Dr. Losper we have our own specific guidelines so আমি কৈছে যে 20টা ভাইল দিব পৰা যাব আৰু লগতে পি ভাইপাৰত কোনো ধৰণৰ এন্টিভেনম দিব নালাগে। So we have trained our 15+ doctor, and thanks to Dr. Losper because we have reoriented our all doctors, and every doctors in the community health center is treating our snakebite victims by these protocols. So this is the rate limiting state, and these are all sign and symptoms, that is early sign and symptoms, so that we can inject antivenom. When to inject antivenom, these are all we have trained our doctors. And you can think that only Demow is doing. No, this is, you can see the Naupata MPSC, the patient was bitten by cobra bite as immediately আহিছে আৰু পেশেন্টটো বচাইছে। ওকে, এইটো আমি আমাৰ হস্পিটেল নহয়, বেলেগ ডাঙৰ হস্পিটেল নহয়, এখন সৰু গ্ৰাম্য চিকিৎসালয় কৰিছে। সেইখন গ্ৰাম্য চিকিৎসালয় যদি কৰিব পাৰিছে, এভৰি গ্ৰাম্য চিকিৎসালয়, এভৰি ৰুৰেল হস্পিটেলস can should do treat the snakebite victim. And this is the latest victims. You can see nobody could thought that this patient would be survive. Etu বাচিব বুলি ভবা নাছিলে, কিন্তু আপোনালোকে সব জাস্ট লাস্ট ব্রেক তো লৈ আছে। এটো কোৰ ওৰাং সিএসসি কোনে দিছে? এজন এমবিবিএস ডক্টৰ দিছে। কোনো ধৰণৰ মেডিসিন ডক্টৰ কোনো দৰকাৰ নাই, এনাস্থেচিয়া ডক্টৰ দৰকাৰ নাই, কোনো বিশেষজ্ঞ চিকিৎসা দৰকাৰ নাই। only thing is that patient to সোনকালে আহিব লাগিব আৰু লগতে আমাৰ ধৰক এই ডক্টৰ বা নাৰ্ছ সকলৰ অলপ যদি সদিচ্ছা ইচ্ছা এটা থাকিব লাগিব। ৰাইজৰ